Okay, hi there, it's Dr. Buford. We're just getting started on the right shoulder. We're looking at from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and right now we've got this instrument that you see. It's called a shaver. It just has a little suction attached to it, and it allows us to smooth out some of the torn tissue that you see so we can see exactly what's going on. So right now we're working on the labrum. To the left of that, that's your biceps tendon, and you can see all these rough edges and things kind of hanging down. That's not normal. These are all areas where the labrum or the biceps tendon are torn, which is what we expected. A little bit more to the left of that is going to be the rotator cuff tear. So here's the biceps. As I tug on it, that's the biceps. And so you can see all that tearing is actually part of the biceps. And then to the left of that, there's a hole here. That's the rotator cuff tear. And so the next step for us is to secure the biceps. We'll take a spinal needle first, and then we'll take a shuttle relay. We'll pull it out of the spectrum handle there. And all we're trying to do here is pass this basically right through the middle of the biceps like that. Take that, and then I'll take this in a grasper. I'll show you some more in a minute. Basically, you're going to see this black wire coming through the needle. There it is there. And hold the camera here, please. That's pretty much all I'm ever going to ask you to do, so you're perfect. And we'll reach in from the front through that blue cannula, and we'll grab this wire like that. Okay, let me see the free suture. We're going to load this outside your shoulder with a stitch. Let me position you a little bit. Yeah, beautiful. And as we pull back on that, you'll see it go through the biceps. See the little white suture there? So now we're going to repeat that exact same process one more time with the spinal needle. So we'll go off on the video and show you when that's all done. Okay, so we've got the suture passed around the biceps. You can see it there. Goes around and through twice. So go ahead and hold again. So that gives us a real good hold on the biceps. And now we're going to go ahead and release it so that it can't continue to tear down here inside the joint. That whole process causes pain. So now, you're good. Now we've released the biceps. You can see it's no longer attached at the top of the labrum there. I'm going to put in the shaver now. Just hold those sutures a little snug, not super tight, but yeah. So I'm going to put in the shaver here, as you see, and just smooth out the rest of the labrum and where we just cut the biceps, which is right here. And now that the biceps is no longer attached, this labrum will be okay. There's nothing else pulling it off the bone anymore. Okay. So I'm going to look down the front of the shoulder. Is there a... Okay, so here we are looking down the front of the shoulder, and the anterior ligaments look fine. Subscapularis tendon looks fine back there, just to the right of the blue cannula. The middle glenohumeral ligament is this little band right below the blue cannula, that little band of tissue that runs up towards the top of the screen. That looks fine. We'll swing around to the back of the shoulder, and this anatomy is checking out okay as well. So now we're going to come back, and from this articular side, this is the rotator cuff tear. It's a big tear. We knew that. And I'm going to put the shaver in just to clean it up a little bit from this angle, because it's hard to get on this side of the tendon once you're looking at it from the top down. But we can see here that it's delaminated. It's probably going to require 1 or 2 side-to-side sutures. And so we're thinking all these things, making plans as we look at this. It's also a big enough tear that we're probably going to have to use a graft, because that's a hole looking right up into the subacromial space now. Okay, so now that we've cleaned it up a little bit, we'll do the rest of that work from the top down. Okay, so here's the tear. You can see it right there. We'll go ahead and let's take a ruler. Let's just go ahead and measure this. There's a metal ruler in the bottom of the tray. my tray. And so while we're getting the ruler, posteriors to the left, we've got this blue cannula coming in the back. We've got another blue cannula coming in the front. If we do a graft, there's going to be another cannula just to the right of me here. You can see the sutures, actually. Those are the biceps sutures. And so sorry for that. We're just getting the ruler in. Okay, so here's the ruler. Sorry for the bubbles. But basically, we're looking at, it's 2 centimeters, shade more than 2 centimeters this way. And actually, once we debride a little bit more, it's going to be probably closer to 2.5 or 3 centimeters at the footprint. In terms of retraction the other way, we can use the other edge of this ruler, and we can see there's a centimeter. So again, sorry for the bubbles, but if we measure from the articular margin, it's retracted a centimeter there. 2 centimeters puts us about here. It looks like we're going to have to put the long side of the graft across the footprint, which means we're only going to be going about to here with the short side of the graft. So that just gives us an idea early on of where we're going to be placing sutures. Okay, so let me get the inserter for that. That's great. I'll just do it like this. And we've got a little bit more work to do before we start doing the initial repair of the tendon. So we'll go off on the video just for a minute. Okay, so here's an example of why we're going to do the graft. When we look at the posterior aspect of this tear, when we lift up, look, this is a great example of what we call a delaminated tear. There's this top part, but when we lift up on it, there's this bottom part that goes back quite a bit farther. And in order to fix this and try and get the best result, we've got to get down to where the tissue still has a good blood supply and is still healthy. And the graft helps us a little bit also with that. So we're going to keep working here. The tear is going to be bigger than what we initially measured because of that. But I just wanted to show you as we make some progress here. Let me see that. Okay, so we've debrided the tear back, mostly posteriorly. And I just want to show you where we're at now. So here's this upper leaf. Here's the bottom leaf. It's split, so you can see it's split as we go back medial. See that split? That's a really good picture of the split in the bottom leaf. See that upside down V? So we're going to put a side to side right across there to hold that together. That'll help the repair. And then we're going to probably do another side to side. And then we'll place several suture anchors in. You can see this bottom leaf really isn't attached to the bone until we get way back there. So we've got a lot of work to do. Let me shut up and get to work, okay? So the next thing we're going to do is go ahead and do a side-to-side suture. Okay, so we just did the first side-to-side suture. It's hard to see because the suture is white. There it is right there in the middle of the screen. The knot is somewhere. Again, hard to see because it's white, but it looks good. Now here's the key though. When we look underneath that same view, see how that's coming together better now. We're going to do one more. These are called ripstop stitches also. There's a bunch of names for them. Side to sides, margin convergence, ripstop stitch. It all means the same thing. And we're going to do one more of them. Okay, so we've put in 2 side to sides. It's brought that deeper layer right to the edge of the articular margin like it often does. So I'm happy with that. This little top here will just lay right down. Let me show you what it'll look like when we're done. That's going to all come down just like that. Okay? See that? And now you can see why those are called ripstop sutures, because if we pass a stitch behind those, it's not going to pull through those 2 sutures. So they're margin convergence sutures also. But now we're going to go ahead and plan our suture anchors. We're going to place the first one posterior, so we'll take a spinal needle. And with these large tears, we often have to internally rotate to make sure we're getting even more posterior, which is to the left. on the humeral head. So when I internally rotate, you can see the ball rotates to the right. That gives me an anchor that's a bit more posterior. So why don't we do that? We'll show you some more in just a little bit. Okay, so there's the second triple loaded all suture anchor in right at the articular margin. The first one we've tied completely using those sutures as ripstop stitches. And so now we're going to tie the second three. We're going to pass them first and then we'll tie them. Crochet. So here you can see how we spread out those sutures from the anchor. That's actually a pretty good shot of how those three sutures are spread out like a claw right there. And we're going to go ahead and get the partner blue and white suture. So now we've passed all three. We're going to retrieve them all out this anterior cannula and then tie them one at a time. So we'll show you once we have these final six, or these last three will make up a total of 6 sutures that we've got passed. Okay, so we've got our sutures from our 2 anchors passed and tied. So this is a 2 side-to-side, 2 triple loaded repair. And that's moving together as a unit. There's still a little bit up here right at the rotator interval that gaps up a little bit. I'm going to investigate that and see if we have to do anything else here. You can see that's right where the biceps is. So one of the things I can do is I can put the biceps down over the top of that, and that'll also function to hold down the anterior cuff. So I think that that's what we'll do there. We'll show you some more in a little bit. Okay, so now we've got the biceps down with a Poplok anchor that also holds down the anterior cuff nicely. And now we're going to take our ruler and measure for the Biobrace. Okay, so we've got the graft. Yeah, we've got the graft in the space. Nothing's tied yet. I just wanted to show you kind of an interval picture here. So there's our stick knots. You can see how quickly it absorbs. Even the purple marking pin stuff is already starting to absorb. And then these are going to be our Poplok sutures at the end. We're going to do the medial sutures first. So the next step is to go ahead and reach in from the back here and grab the stick knot right there. So we'll show you we need a grasper. And we're going to reach in from the posterior cannula. We're going to grab this right here, pull on it, and now we're going to clip off the stick knot and tie a knot. Pause. Can one of you take off that setting, and then we can pause the video? Pause? Yeah, that'd be great. Well, see on the screen, it's in this in the settings mode. Yeah. If I keep going back. Okay. Okay, so we've got our 2 medial sutures tied. You can see them there. We're going to cut those suture tails a little bit short. Actually, we're going to go ahead and cut the suture tails, I should say. So we'll get that done in just a minute. But you can see how that's got the medial aspect tied. Again, our midline purple stitch is already being absorbed, but we can see how now once we get this down, this is going to sit right over the top just like that. Okay, so we're all finished here. We've got our 2 medial sutures. We've got our 2 lateral Poplocks. And those look very secure. And as we rotate, you can see how that graft, let me get something here to clean up a little bit. You can see how that graft rotates nicely. And it just sits right on top of the repaired rotator cuff. Okay, so we've done a rotator cuff repair. We've augmented with a Biobrace. We've even done a suture anchor biceps tenodesis as well. All right, now I'm just trying to give us a good, pretty picture at the end. There you go. And so the final thing we can do is we can take a little punch, a little 2mm punch, guys, the little Bio Mini Revo punch. It's gold. And we're going to make some little holes in the bone right there, maybe just a couple. But I'm happy with the way the Biobrace looks. As we rotate, that looks real good, okay? So we're going to finish up and get you back to the recovery room shortly. Good luck to you now. Bye-bye.